tests done, giving us a total of 139,242 positives out of 1,398,630 samples tested to date. We have sadly lost 1,647 persons, while 112,557 persons have been successfully treated and discharged. The sheer volume of patients we are getting does not allow the reduced case fatality rate to 1.2 to be appreciable. The response strategy of the Federal Ministry of Health still rests on 4 prongs. First is to continue with infection prevention, infection mitigation, with stricter implementation of public health measures, or what is otherwise known as non-pharmaceutical interventions. Secondly, upgrading and refining therapeutics and treatment, which help to improve survivability of those who have of the disease by those who have been infected. Thirdly, vaccines which have become a central global topic. And finally, the maintenance of routine, essential hospital services like antenatal care and care of other chronic ailments. As I said just now, the improvement in therapeutic strategy might seem to be yielding result with a case fatality below 1.2, but the sheer numbers in case fatality, the sheer numbers make this number inappreciable. The increase in oxygen availability began with the repair of 2 oxygen plants at the National Hospital Abuja through the effort of the federal government intervention and the commendable intervention of the private sector, who have ensured that large quantities of oxygen cylinders are delivered to treatment centers as needed in many parts of the country. This has helped to improve availability of oxygen for management of critical cases and help to reduce fatality. But it has also helped to treat other illnesses that depend on oxygen supplementation, such as asthma and pneumonia. With regard to vaccines, Nigeria has kept very much abreast of global development, and Nigeria supports the call of the World Health Organization for fair and equitable distribution of vaccines to all countries of the world, because COVID-19 is a threat to all of mankind, not just to certain countries, even though some countries appear to be suffering more at the moment than others. We also subscribe to 2 multilateral vaccine access platforms. The first one being the COVAX facility that will supply all members, 92 members of the ANC commitment part of the COVAX, including Nigeria, low and lower middle income countries, get the vaccines free of charge, but we have to cover the cost of logistics and delivery. This will cover 20% of our population. Since we are striving for a higher percentage to get herd immunity, we have to cover the rest. And the rest of it will come from the Africa Harvard facility, which is the Africa Union Africa Vaccine Acquisition Task Team, chaired by the President of South Africa, President Ramaphosa. Harvard has acquired 300 million doses of 3 types of vaccines, which have been offered to African countries according to population. And the strategy is that no country is left behind. Nigeria subscribes to this whole of Africa approach that strives to ensure that we are safe and our neighbors are also safe. We shall be offered over 42 million doses of vaccines, and if all projected vaccines that we're talking about now come to fruition, we estimate we should have covered 45% of eligible Nigerians to be vaccinated before the end of the year. In addition to these proposed sources of vaccines, Nigeria is having bilateral negotiations with Russia and India, with Russia over the Sputnik V vaccine, which they are willing to give to Nigeria, and also with the Indian High Commissioner over the vaccine from the Bharat Institute of India. Both vaccine dossiers have been submitted to Nigeria. They have been handed over to NAFDAC and they are under evaluation. I want to here request all viewers and readers to disregard the news over the weekend that Nigeria was disqualified from vaccine allocation. This is patently false, has no basis, because Nigeria has freezers minus 80 cold chain stores in Lagos, Abuja, with space to hold over 400,000 doses of this vaccine. In fact, more than the 320,000 that were being distributed over the weekend. Those vaccines have been reserved for countries with very, very high burden, to which Nigeria did not belong. And that's why Nigeria was not mentioned. Nigeria was not even mentioned at all in that statement, and it remains a mystery how somebody slotted Nigeria in and deduced something different, drew a different conclusion. Now, our vaccine deployment strategy, again, is to target essential health workers. Those are the ones who are actually exposed to risk of infection, make about 25%, 0.25% of our population, and we make sure that they are all well protected, and for their own sake and for the sake of those they see. We shall also prioritize the elderly, who, from reports we know, are likely to suffer more from COVID infection consequences than others, and persons with vulnerabilities, diabetes, heart disease, hypertension, and so on, who are also quite vulnerable if they get infected. This is a strategy that has been recommended by the World Health Organization, which all countries in the world are using. We have made elaborate plans and micro plans to roll out the COVID-19 vaccination and to address any gaps in financing the early rollout activity. National Primary Healthcare Development Agency is responsible for carrying out this vaccination and is the only one in the country authorized to do this vaccination. No private sector vaccination is provided for. At the same time, all the vaccines come from official Ministry of Health sources. National Primary Healthcare Development Agency will be working in close collaboration with state governments, and we do urge at this point all state governments to be ready and prepare themselves to hit the ground running as soon as vaccines begin to arrive. And the NAFDAC team has prepared to evaluate all vaccines that come into the country, beginning with looking at their dossiers. Now, I want to say that it's very important to remember that the public health measures we have been talking about remain valid. Not only valid, but will remain significant even though the vaccine is going on. The vaccination is going on. because they are the best options in beating the pandemic, despite deployment of the vaccine. You hear that in many countries where they are giving the vaccine today, if there's any improvement now, it's not from the vaccines yet. It is from continuing to observe the non-pharmaceutical interventions or the public health measures, as we choose to call them now. So I want to remind everybody again, wear your mask when you're in a public space, observe physical distancing, wash hands regularly with soap and water or used a sanitizer. Also, do not transact any business with someone who is not doing the same thing with you. And if you are outside and anyone approaches you who is not protecting himself, make sure you keep a distance from that person and do not engage in any kind of conversation with a person of that nature or person not properly prepared. And if you feel unwell or you have any symptoms, fever, cough, or even if nowadays we hear, even if there's no fever and cough, you have breathing difficulties, loss of sense of taste and smell, go to the nearest testing facility to determine your status. The earlier you are diagnosed, if you are positive, the better it is for you. The less risk, the less chance you stand of going into intensive care. If you wait and delay, especially if you have any comorbidity, the illness manifestation can be much worse. You might end up in an intensive care requiring oxygen or requiring intubation. Again, I want to say, repeat, that prevention is better than cure. It is better to protect yourself. And you might sometimes find yourself in the embarrassing situation of protecting yourself from very good friends. But you have to do that. And prevent also grandparents from the risk that grandchildren might bring. Thank you for your attention.
Chair of the Presidential Task Force and Secretary to the Government of the Federation, Honorable Ministers, colleagues on the Presidential Task Force, gentlemen of the press. Thank you all for your continued support during our public health response. Although we have seen over the last few weeks a small decline in the number of confirmed cases, this must be interpreted with caution. We must continue scaling the response, practicing public health and social measures to prevent transmission. So I'll update you very briefly on 5 key areas of the response. Firstly, we have continued to support every state, both for the COVID response and to prepare for a future outbreak. So last Friday, together with the Honorable Minister of State for Health, we were in Taraba State to commission a new infectious disease center at the Federal Medical Center, Jalingo. In addition to this new infectious disease center, we also commissioned a new molecular lab in the same Federal Medical Center, put up by the Federal Medical Center itself. So this is the new infectious disease center is one of 4 new infectious disease centers that have been commissioned over the past 12 months, and there are 8 more at different stages of development. So in Taraba State, right now we have a new infectious disease center, a new molecular lab, a new public health emergency operating center, all within a year. So we could have been better prepared at the beginning of this pandemic, no doubt, but as we've demonstrated in Taraba, we're building on this crisis using every opportunity to develop the capacities in the states. Right now, as we speak, Taraba is not only responding to cases of COVID, but also responding to increasing cases of Lassa fever. So we're very grateful to His Excellency, the Executive Governor of Taraba State, Governor Darius Ishaku, and of course my colleague, the Medical Director of FMC Jalingo, Dr. Aisha Shehu Adamu, who really provided the support and engagement for these structures to emerge. With these new resources in Taraba, we need strong leadership and coordination by the state to protect the health of the people of Taraba, and at NCDC we're committed to supporting every single state in Nigeria, as well as the FCT, of course, to support the state-level preparedness for outbreak response. Like we've said always, the states are the center of everything that we do. I also wanted, secondly, to update on the challenge of fake test results. You may all recall last year, a media house reported on widespread existence of fake testing results, especially for travel purposes. This is a challenge for the Presidential Task Force, a challenge for NCDC, and a challenge for all of us. So last week, with the FCT administration supporting us in an investigation that ended up in the ceiling of one of those centers here in Abuja. This center had been collecting funds from citizens and issuing fake results. So in these labs and testing centers, samples are collected from people, and there's no evidence that a test is done. Results are provided, and people go around with those results and continue with their travel with the best intents purposes. However, we really appeal to all Nigerians. Listen, it takes two to tango. We have published on our website all the authorized, accredited private labs where travel-related testing can be done. There are 33 of them in Nigeria, all of them on our website, ncdc.gov.ng. If you choose to go to any other center outside of these, you are part of the problem. So citizens also have to take some responsibility themselves in not patronizing these other centers. From our end, we are at the final stage of deploying a platform through which every private lab in the country will be reporting their results, and every single result out of Nigeria will be able to be verified by any airline, any embassy, any foreign country. So whoever is practicing any of these things had better find some other business to earn their living, because we're about to make you go out of business for this particular unfortunate endeavor. But for last week, we're of course very grateful to the Honorable Minister of the FCT and colleagues in his department who were very supportive in identifying and sealing this particular center, and we urge all states to also enforce similar measures in their states. Thirdly, with regards to testing, we're doing everything within this response to improve and prepare for more testing. We've always said we understand that this is not easy. It's not just about building labs or deploying equipment. So last week at the National Reference Lab, we carried out the first extensive training of molecular scientists in Nigeria to be able to test for COVID-19. We recognize that this pandemic came out of the blues, and we recognize that many people were not prepared for what it took. So we had 28 excellent participants from 15 public health labs in our network. I remember sharing at the beginning of this pandemic that one of the biggest challenges that we faced was that many people came out of university unprepared for the type of work that we have to do. So we had to do something about it. So we've developed this new course to train our people who will in turn train others. We're building a much bigger workforce for molecular diagnosis in Nigeria. Some of the facilitators for this workshop were colleagues that we had trained at the beginning of the outbreak, who are now building this capacity in others. So I'm very grateful for our partners at the World Bank, the World Health Organization, the US CDC, IHVN, Public Health England, the Tony Blair Institute, all of whom we mobilized to support us in delivering this program. This is the first cohort that we have just completed, and we're going to have several more cohorts come through NRL over the next few months to grow in their capacity to do the work that we have to do. Fourthly, in the spirit of collaboration over the last week, we've been working with the Federal Ministry of Foreign Affairs, Federal Ministry of Aviation, Port Health Services, the Federal Ministry of Health, FAN, and FCT to receive and screen returnees from Saudi Arabia. Given the peculiarity of their return, government has taken responsibility for their post-arrival testing and screening, and we used RDTs and supported their quarantine thanks to all other government parastatals and ministries involved. So this is taking a lot of effort and resources. What was really an example of the strong coordination across several government institutions responsible for this type of activity when it does happen. So we're very grateful for the collaboration of all our government partners, sister ministries and agencies, who together we have successfully managed this group of returnees, and part of them are now on their way home. My fifth and final update on today is on the variants of concern. I'll start with the national picture. Like I've always said, in this regard, we are working very closely with the Africa Center for Excellence in Genomics at the Redeemers University in Ede, and Professor Happy and his team have to be given a lot of credit for the work that they're doing in collaboration with us. So this week, we detected 6 additional samples of the B117 variant in Nigeria. The B117 variant is now the dominant strain in the UK. And these new cases in Nigeria from Lagos were detected, these new 6 cases were detected in Lagos. So in total, we now have 13 of these B117 strain in Nigeria, 6 from Lagos, 5 in Osun State, 1 in Kwara, and 1 in a patient from the Federal Capital Territory here in Abuja. Just to also say, we have not yet detected any of the B1351 strain, which is the dominant strain in South Africa, and some of you would have seen reporting about this over the weekend. We've been looking. We haven't found this in Nigeria. We're grateful for that. We will keep looking as we intensify our sequencing activities over the next few weeks. So finally, just to say, this pandemic is not over. We must continue to protect ourselves the best way we can. Within the NCDC and our partners, over the next few weeks, we're increasing our genomic surveillance to make sure we can increase our capacity to systematically sequence samples and see whether any of these variants of concern are circulating in Nigeria. But remember, whatever the variant is, whatever the type of virus is, do what you can do. Please continue to avoid large gatherings the best you can. Wear a mask always, wash your hands regularly, and always maintain as much of a distance as possible between you and everyone else. Thank you very much.
Mr. Chairman and Secretary to the Government of the Federation, Honorable Ministers, Chief Executives, Permanent Secretaries, Director of Press, SGF Office, ladies and gentlemen of the press. Today, I'll be giving you an update on ramping up of testing across the states, enforcement of international travel, as well as the health protection regulation. The PTF has sent technical teams to conduct supervisory visits in each state across the Federation and to observe the COVID-19 interventions and provide technical assistance towards addressing any challenges. The goal of this exercise is to increase the level of testing by ensuring that we have sample collection centers at local government level. Laboratories are optimized and functional, and commodities adequately provided. Tests and results are reported efficiently within the prescribed turnaround time. I would therefore like to use this medium to thank and congratulate all stakeholders for their collaboration and support. This includes the state governors who have provided resources and the enabling environment to ensure that these samples are collected as and when due. The state honorable commissioners for providing the state teams that work day and night to ensure that they visit every local government, collect these samples, and turn them around. Other members of the state ministries of health have also provided their own input. We also want to extend our gratitude to the World Health Organization and the U.S. Agency for International Development for availing their logistics tools in the states to ensure that samples are moved in time. These teams continue to work tirelessly to ramp up the number of tests conducted on a weekly basis, and these numbers are bound to show us where the epidemic is going so that we can prepare and mitigate. As you may be aware, regarding international travel protocol, the NCAA last week had sanctioned and suspended an airline for its failure to comply with testing requirements and travel policy. While we continue to explore the infrastructure for setting up rapid antigen testing, the standard shall continue to be the PCR test performed at least 96 hours before departure date, and the second PCR test on the 7th day after arrival. Only accredited laboratories currently on the travel portal will be allowed to conduct this rapid testing when the PTF provides approval. In the meantime, the PTF will continue to monitor compliance by all international airlines and approved laboratories and take necessary action on travel advisories for national interest and greater public safety. Last week, we received a report of some passengers who violated entry protocol, and they were reported to have jumped quarantine. We are taking the necessary steps to ensure that these people are prosecuted. For the benefit of the public, let me therefore reiterate the protocol. Passengers must have a valid negative PCR before they arrive into Nigeria. If you violate this protocol, you arrive without a negative PCR or with a fake COVID-19 negative PCR certificate, you will be taken into quarantine. We will test you on arrival to ensure that it is safe to put you in our quarantine facility, and by expiry of your 7-day quarantine, you will test for a PCR again. These passengers will be responsible for all the bills, including hotel and laboratory testing, and they are also liable to prosecution at the COVID-19 tribunal. Jumping quarantine is a grave offense which is punishable by imprisonment, and PTF will not shirk from prosecuting any violators. Nigerians must ensure that they comply to the provisions of our entry protocol because it is in your own best interest. Remember that if you connive your way through the airport and obtain a negative PCR result, you will be at a risk, a very high risk, of taking COVID-19 infection to your home and infecting your loved ones and the people in your community. On the enforcement of the health protection regulation, the FCT administration has set the pace, and they have started doing the needful by ensuring that there is compliance in public places in and around the FCT. Generally, the information reaching us is that more people are now compliant. You see more people wearing face masks and adhering to the non-pharmaceutical interventions. Public places are reported to also ensure compliance in their premises. We therefore commend the Federal Capital Territory for this effort. It is pertinent that other states also revive their task teams and ensure the regulation is contextualized and implemented to curb community transmission. States are called upon to pay particular emphasis on markets, workplaces, schools, banks, public transport, and places of worship. Finally, the PTF will be publishing the list of 100 passengers who have violated the COVID-19 protocol tomorrow. This list has been submitted to Nigerian Immigration Service and will be available on published newspapers tomorrow. Finally, CARCOVID has distributed or is distributing oxygen cylinders as well as regulators and trolley. As the Honorable Minister of Health mentioned, this is an effort from the private community to ensure that they provide their support or to provide the life support needed for patients infected with COVID-19 who are in a very high or severe condition, who require oxygen. About 1,000 cylinders will be distributed to 12 states. These are 12 high-burden states based on hospitalization. The states include Enugu, Nasarawa, Plateau, Kwara, Kano, Edo, Kaduna, Anambra, Ogun, Oyo, Borno, and Rivers State. These cylinders are provided free, and oxygen is also available and is also free at 2 locations in the country. One is in Suleja, an oxygen plant, and also the second one in Ojigo, Ogun State. The states will now be responsible for the filling of this refill of these cylinders at these designated locations. The PTF has already communicated to the states and informed them of this contribution. Thank you.
The Chairman of the PTF and Secretary to the Government of the Federation, Honorable Ministers, colleagues, distinguished ladies and gentlemen, good evening. I'm glad to be here again to give you an update on our collective journey towards controlling the spread of COVID-19 through the deployment of COVID-19 vaccines. As earlier communicated, and I continue to get questions about this, Nigeria is no longer expecting the 100,000 doses of the Pfizer-BioNTech vaccine through the COVAX facility, but has been allocated about 16 million doses of the AstraZeneca vaccine. This was based on epidemiological and equity assessment done by the World Health Organization. These vaccines will be arriving in batches starting by late February. I want to reiterate that these vaccines will be provided free of charge. It is noteworthy that Nigeria was actually considered as one of the countries that is ready to receive the Pfizer vaccine. But because of the distribution intended to achieve public health value, it was not practical to provide every capable country with the Pfizer vaccine due to its limited quantity. This necessitated further review by a multi-agency committee to narrow down the selection process. This information was disclosed to us by the country representative of the World Health Organization. As stated by the WHO Regional Director, a number of factors were considered before allocating the small quantity of 320,000 doses of Pfizer. As you may be aware, the South African government has suspended their vaccination with the AstraZeneca vaccine in response to findings from a study which showed that the vaccine was less effective, which showed that the vaccine was less efficacious against the B1351 strain of the COVID-19 virus, which is the predominant strain in South Africa. Here in Nigeria, and the DG of the NCDC has mentioned this, we are yet to isolate this strain. The NCDC is working with NIMA and other researchers to intensify the search for this strain from samples collected. Furthermore, every positive sample of travelers arriving from the UK and South Africa are further subjected to genomic sequencing to determine the strain that the traveler is carrying. In the meantime, we will continue to work with NAFDAC to ensure that only a vaccine which is effective against the predominant COVID-19 strain in Nigeria will be administered. As part of our ongoing awareness program, we also met with the National Youth Council of Nigeria, the leadership of the Radio, Television, and Theatre Arts Workers Union, and plan to meet with over 50 more organizations and critical stakeholders to provide them with factual information that can enable them produce educative content on the safety of COVID-19 vaccines. Permit me to use this medium, gentlemen of the press, to draw your attention to the important work that you do for being the gateway of information to the general public. It is crucial that you get your facts right in order to present accurate and objective reports and contribute to fighting misinformation. The COVID-19 pandemic has no doubt posed a crisis amidst all of the societal challenges that we'll face. There's therefore no better time to be a patriotic citizen than now. I am confident that working together as patriotic Nigerians, we shall collectively overcome the challenges. I want to use this opportunity to reassure Nigerians that the federal government and the Presidential Task Force on COVID-19 will do everything possible to acquire sufficient COVID-19 vaccines that are safe, efficacious, and available for deployment. At the National Primary Healthcare Development Agency, we're fine-tuning all of our strategies to make sure that we not only utilize our traditional campaign strategies that we're all familiar with, but also learn from what other countries are doing while working with the private sector and using frontline technology to optimize our ability to deliver vaccines to Nigerians in a timely manner. I thank you very much for your attention.
We want to thank you, Executive Director, National Primary Healthcare Development Agency, for reminding all of us in the media of our MASCOM 101, fact-checking. I'm sure we would remind ourselves of that principle before we rush to the press. Well, the time has arrived for my colleagues to now ask questions. We're ready to go. Channels, are we ready?
Good evening, sir. My name is Friday Okerebe. I'm a reporter with Channels TV. I think I will direct my first set of questions to the Minister of Health. You just told us that we're expecting 300 million doses of 3 types of vaccines from the African Union, AVAT. I want to know if those vaccines are already in the WHO listing for emergency use. And closely related to that also, since we have ultra-cold freezer in Lagos and Abuja that have the capacity to hold 400,000 doses, or over 400,000 doses, the exact word that you used. Considering the fact that we're expecting 16 million doses of the AstraZeneca vaccine, can you say that we have enough capacity, freezing capacity, to hold these vaccines? And the last question, I will appreciate if the ED of the National Primary Healthcare Development Agency will respond to that. It's actually regarding the AstraZeneca vaccine. Just yesterday, like you rightly mentioned, the South African government have actually stopped the rolling out of that vaccine. And the concern that I have, which I want you to address, is this. Why are we actually opting for that when that vaccine is not in the list of the WHO emergency use, vaccines for emergency use for now, when we have other vaccines apart from the Pfizer vaccine that, because of limited supplies, we are not going to get it now. We still have other ones that are already in the listing. Why are we opting for the AstraZeneca instead of the others? Thank you.